Hi guys, and welcome back to my channel. My name is Jamaya Rocheal. Thank you for tuning in and joining. If you're new, hit that subscribe button, comment down below, and like this video. And we're gonna get right into it. So as you guys should know, and if you don't, I am a nursing student at Georgia State University, and I just finished up my second semester, which means my first year of nursing school is complete. So I already did like a first semester recap, but I want to do a second semester recap because I feel like the second semester is when ish really got real. Even though my first semester was, you know, it was tough. Like I struggled a little bit. Second semester is when things kind of kicked it up a notch. So I actually took my first set of clinicals. I don't know if that's what I should call it, but I took clinicals for the first time since being in nursing school, and that was definitely an experience. And I have notes, so if I'm like looking down, that's what I'm looking at. So this semester or last semester I took pharmacology, basic health assessment and nursing skills, and then basic concepts of nursing. So pharmacology is pretty much where you learn all the medications, the categories of medications, you learn the class, you learn contraindications, you learn adverse effects, you learn nursing interventions, drug indications. So pretty much you learn why you're using this drug, what the drug is used for, what the drug does in your body, how it affects your body, if this drug like mixes well with other medications. So can you take this drug alongside another medication, or is this a drug that you would have to take by itself and kind of put other medications on, you know, on hold? That was pretty much what that was. And then we also learned like drug calculations, drug dosage calculations. So you learn, you know, how much of a drug you should give and how to calculate that if it's not done for you, which is very critical in nursing. Like it's extremely critical that when you're administering medication, you know how to administer that medication, you know where to administer that medication, and you know how much to give to your patient, because you don't want them to get sick, you don't want them to overdose, you don't want you just don't want bad things to happen. You want to know what you're doing. You want to actually help your patient when you're administering medication to them. And then basic health assessment and nursing skills, that is the class where our clinicals was like mixed into that class. So we learned about the skills in class, which was a lecture. It kind of taught us, you know, why you do this particular thing, how to do it, who to do it to. And then in lab, you learned, you just kind of practice. You practice those skills. You got, you know, you mastered them, or that was the goal, to master those skills. And then in clinicals, you actually got to perform those skills on actual patients. So lab was interesting because we had checkoffs, and you could fail your checkoffs once and then retake it, and if you failed again, you got a clinical failure. Like what? Or a lab failure. Yeah, and then you can only get 2 lab failures, and then you completely fail the class, which means you have to take the class over and the clinicals over. Oh my goodness. And I don't know how many checkoffs we had, but there were a lot, like at least 10, I believe. And the first one was drug calculations. So you had to pass that quiz with a 100%. It gave you a variety of drug calculation questions, and you had to do those problems, work those problems, figure out the calculation, the dosage calculation, and get a 100% before you could proceed to clinicals and administer medications. So if you didn't pass that, you couldn't move on to clinicals. And if you don't do clinicals, that's a part of your grade. So if you fail clinicals, you fail the class. So and that's how every test was. Like every checkoff, you can fail it twice. I'm sorry, Haley is like walking. She thinks she owns the place and she's hitting the thing. But yeah, so that was like a little pressure, but it was actually very fun because you actually got to be like a little mini nurse. We're called student nurses. So you got to practice and you got to hear things, do things, get your hands dirty. And then that brings me right on to clinicals. So in clinicals, I'll probably make a separate video on that, because clinicals in itself was a whole story in itself, but that all was combined into one big class, and I actually loved it. I love my professors for it. I loved all of my professors this semester. Even we know we had one professor that people didn't particularly care for. She was interesting, but I liked her. She was nice, she was funny, but she did kind of answer questions a little weird, or she really wouldn't answer questions, kind of, sort of. But besides that, I liked her. So the last class that I took was Basic Concepts of Nursing, which is the class that was taught by the professor I was just talking about. So in Basic Concepts of Nursing, you actually learned about care plans, how to write care plans, how to write nursing diagnosis. Is that how you say it? Nursing diagnosis. You had to come up with the nursing diagnosis, which explains, you have to tell what the problem is related to, and as manifested by what shows you that this is what's happening. So if a patient, you know, has like a UTI or something, and they have pain while they're urinating, you could say the patient is exhibiting anxiety related to pain from urinating, or you could say or you could say related to the UTI as manifested by pain in the urine. The patient is refusing to go to the restroom because they have fear of the pain, blah blah blah. If I said, you know, you get the gist of it. You get the gist. And if you don't get the gist of it, when you go to the class, you'll understand what the heck I was just talking about. But that was kind of like what that class was about. So each body system has their own set of problems or diseases or disease processes. And so you had to pull out the problem with those diseases, or, you know, whatever. So for us, like, you had to kind of differentiate between a medical diagnosis and a nursing diagnosis. So you wouldn't come in here and say, oh, my patient is having a myocardial infarction. You wouldn't, I mean, infarction, what am I saying? Myocardial infarction. You wouldn't say that. You would have to say the patient is, there's insufficient blood supply to this, or insufficient tissue perfusion, you know, whatever. You would have to like word it a different way and kind of learn how to put the puzzle pieces together to make the care plan. So when you make the care plan, then you have the problem, you had the diagnosis, interventions, you have evaluations, you have all these different things that you have to put together that paints the whole picture of what you're going to do in order to care for your patient while they're in your care. So all of those classes were very interesting to me, because it really laid down like the foundation of nursing. The first semester with pathophysiology, you know, that was really stressful because you had all of these different disease processes thrown at you, and it was just kind of like, you know, what do I do with this information? But the second semester, it kind of brought it all together, because it's like, okay, these are the disease processes. So I know if a patient has, you know, this problem, or if you know, the doctor says that this is what the problem is, I know that this means A, B, and C. And if A, B, and C are the problems, then I know that I have to do this, this, and that before the patient can show progress that they're feeling better, you know, or whatever. So that was really interesting. I really liked it. Of course, it was hard. I mean, I feel like every semester is going to be difficult, because like I said before, my time management, it just sucks so badly. Like, I haven't mastered it yet. Like, I haven't mastered it, and I'll be the first to admit that I'm lazy. And you can't be lazy. Like, I'm gonna have to get it together for sure. You can't be lazy because it's a lot of information. And if you let yourself procrastinate until the last minute, you're going to get extremely overwhelmed, because it's very easy to get overwhelmed with the amount of material in the first place. So throw in you waiting until the last minute to do everything, honey, no, that's not going to work. So, you know, that's something that I really learned from my first year of nursing school. First and second semester taught me that. So going into this second year, look, I'm going to have to be on it, period, because next semester I have med surg, which everyone, you know, raves about how hard med surg is and how difficult it is. Say hi to Haley, y'all. She just doesn't know what to do. She just keeps walking in between my tripod, knocking it. Say hi, everybody. So I'm getting a haircut soon. A haircut in a bath today, actually. Alright, man. I'm gonna put you down, okay? Please stop knocking into the tripod, okay? But yeah, so my first year of nursing school is complete. I made 2 B's and a B+, and I really could have gotten a freaking A-, but you know, whatever. Look, next semester I'm gunning for those A's. Like first semester I got that ugly stupid C+ in pharm, and not pharm, in patho. I was so heartbroken. So this semester I was determined not to get any C's, and I did not get any C's. So next semester I'll have B's, and I'll have A's. This last semester I had B's. Next semester I'll have A's. And if you guys have any questions, oh my goodness, Haley, please. If you guys have any questions, leave them down in the comment section. I've gotten a lot of DMs, so you know, you guys can continue to do that if you like. Like this video, leave your suggestions, and that's it. Thank you for watching, and make sure you subscribe if you're not a subscriber. Bye, guys.